Well, I got to tell you something. The first thing I saw, well, there's a couch up here, and it reminds me of the psychiatrist's office. So, so if you want to ask me something like, how does that make me feel?
Well, I'm about the first question's like, how was your childhood? How was your family?
Right.
So that does seem a little, yeah.
That's about it.
But yeah, so tell me a little bit, where did you grow up and what was your childhood like?
Well, I was born at Detar Hospital.
All right.
And I work
Me
at
too.
Citizens. So there you go. But no, I mean, and I actually recently lost my father, and so I'd lost my mother about 5 or 6 years ago, and so we went through the painful task of, going through the house and doing the estate sale and all that stuff. And I actually found pictures of Detar Hospital in 1960 when I was born. It looked like a little house on this corner. I mean, I was like, I got born there? I was thinking a big giant hospital like the one I work in now. So, yeah, Victoria has grown. Victoria has changed.
And so, did you go to college? And if so, where did you go?
Well, I went to, it was Southwest Texas State back at the time. Now it's Texas State University. But no, I graduated from there. And, I always wanted to be a doctor. I didn't really know what else to do. I mean, ever since I was a child, I just thought about being a physician. But I kind of took a different path than most people. I went to school and I graduated with a degree in health science in 1983. But somewhere around 1981, 82, I was walking through the health science center and I saw this little deal up on the wall that said, be an EMT, and they had an EMT school there at Southwest Texas. And so I said, well, that emergency medical technician stuff sounds kind of fun. It'll look good on a resume. I'll do it. And I remember going into that thing, and I did that class. And that first night, the paramedics on duty walked in, and they had all the cool stuff on their belts, and the radios and nice uniforms. And I was like, I got to do that. So I finished, and I went to paramedic school there at Southwest Texas. If you're familiar with Texas State, there's the old main building, the big, beautiful building right in the center of town. And I see a lot of people nodding their heads because it's such a architecturally beautiful building. I actually did my paramedic class in one of those one of those rooms in there. I think it's the only place they had available for the paramedics. So I did that, and I finished in 1982. And I said, well, I'll do this CMS deal for year or two, and then I'll go to medical school, or I'll apply. It was pretty challenging to get back in the day. It still is, I guess. But anyway, like 11 years later, I woke up and said, I'm still a paramedic, and I need to do something. So I applied, and I started medical school at 32 years old. So, yeah. Yeah. There's some other people like that. There was one guy in my class, he was a physics professor, and he was 51 years old when he started medical school. So I felt pretty good about that. So anyway, and he finished, and I guess he went to be a doctor too. But no, I did that and went to medical school, and 4 or 5 years later, I was doing a residency, and I did a residency in internal medicine at the University of North Texas State University up there in Fort Worth, and I was there for 3 years. But during that time, I did a bunch of emergency medicine training too, so I actually became board certified in internal medicine and emergency medicine. So because, being the paramedic thing, I really liked the ER stuff, and I worked in ERs. I remember at one point I was credentialed in 27 different hospitals in Central Texas, and I was young and single, and they'd call me about 30 minutes before a shift started and said, hey, we ain't got a doctor in Cotulla. And I'm like, where's that? And this was back before, Google Maps, and they would tell you where to go. So I would drive into these towns, and I would follow the little blue H sign because, my first shift ever was in Sweetwater, Texas, Only thing I remember about that is I was afraid I was going to see somebody bit by a rattlesnake, and I wasn't sure what I was going to do. I think that where they have that rattlesnake roundup, I think. I don't know, out there. But anyway, so I just did that, and then finished my residency. And I remember I finished my residency on July 3rd, because in July is when the residency starts. So I finished July 3rd. I packed everything up in my little white trailer, and I drove back to Victoria. And I drove all day on the July 4th. I got home about 10 o'clock that night, And that next morning, on July 5th, Dr. Oscar Zuniga, an internist here in town, a lot of y'all probably know Dr. Zuniga. I went into partnership with him, and I remember him, I got there that morning, still had my trailer hooked up to the back of my pickup. And I said, I'm here, I got a stethoscope, I'm a doctor. And he handed me the keys and said, good luck, I'm going on vacation. And that was it. And later that day, I put my first person in the hospital. I'll always remember that guy. And he had acute diverticulitis, and I was petrified. Because before you've always got, in residency, you've got 3 or 4 people smarter than you overlooking what you're doing. And but when you come back to Victoria, that's kind of it. you gotta make the decision, and it better be the right one. So anyway. That's a long answer.
Hey, no, that's a fantastic answer. And I know for me, as well as probably all of you, I'd be betting to say is that there were so many takeaways from that, but also I love that it's never too late to start. You use example of someone else you knew, but also yourself, that if you want to do something, if you change your mind, then go for it. You never know what roads it will lead you to or where it will take you.
I remember there was a guy that I worked with, and he was a real nice fella, an older paramedic, and he'd probably been a paramedic 10 or 12 years, 15 years before I even started and did my 10 or 12 years. And I remember thinking, he was like 45 years old, and I would look at that guy and think, I better, if I'm going to be a doctor, I better do this, because I don't want to be a paramedic forever. I mean, I love it. In fact, I'm still a paramedic. I kept my paramedic certification because it meant so much to me. And I've been a Texas Department of Health certified paramedic since February of 1982. And there's people out there over here going, 82? I wasn't even born. So anyway, but it's been a long road, and I still like emergency medicine. Currently I'm the director of emergency service, or at the ER at Citizens, or the ER medical director. And we just opened that new ER. I don't want to brag about it, but I've worked in a lot of ERs in my career, and that is a stunning, unbelievable 33,000 square feet. So I hope you don't have to see it, by the way, but if you do, it's a very nice facility, and it's really, and I really applaud Citizens for building that for not only our community, but our region. I mean, there are a lot of people that are going to benefit from that. So. And
we are so lucky to have healthcare systems like we do, like that, Citizens in Victoria, because it is really nice to have a place to go. And hopefully most of us don't have to see it, or all of us don't, but if we do, we know that there's a place that we can go, and it's really great, and we have someone amazing there overseeing it.
I think it's a great facility, and I think that, the people that are there, I've worked in a lot of different places, and really the people there are very dedicated to what they do. And it's kind of the small town thing. I mean, the other directors that I work with, there are a couple of them that I went to high school with. So, I mean, it's kind of a small town feel, and that's nice because, everybody knows somebody. And so, a lot of the rooms I walk into, I know them, and so, or I know someone that knows them. So, it encourages you to make sure you do the right thing.
And for those of you who don't know or haven't experienced, he is so compassionate. When my grandmother passed away, he was there and just so kind, and just really handled it as if it was his own mom. And I'll never forget that. My dad's in the audience as well, and he knows that, and my brother. And so it is a big deal. It's not just him saying that he knows the people and he goes in and treats it. He treats everybody like family, and that's really rare, and that's really special. So thank you for being in our community, but also caring beyond. It's not just a job to you. If you're hearing what I'm hearing, it keeps resonating with me. This was his passion. He always knew that this was a calling and something he wanted to do. And speaking of jobs, though, what was your first job you ever had?
I'll tell you what, my parents, my dad worked all the time, and we had a company called Crystal Ice Company that my dad founded, and that started with one 450-pound machine in our garage, and he made my mom clean out the deep freeze so that he could store 6 50-pound bags of ice in the old deep freeze that opened up. And we had one customer, it was Sun Valley Ranch, and every Friday, my dad would throw those 6 bags of ice out there and drive them out to Sun Valley and sell them. And then we built one in the backyard. So really my first job, I think I was 12 years old, and I got paid 25 cents to empty out an ice machine into these bags and take it into the little vault that we had in the backyard. So, but I think back on that, and I guess I was, I don't know, 10, 12 years old, and I was, knocking down $10, $12 a week, and, but I'm telling you what, when you're 12 years old in 1972 and you got $10 in your wallet, you were something. So I learned early that, that working hard had benefits. And I will never forget this. And I've told my wife this too. And my wife, says, you work a lot. And I say, yeah, I do. But I remember my dad telling me one time, and I told my dad, he rebuilt a hydroelectric power plant in Cuero, and he was working there, 10, 15 hours a day, every day, 7 days a week. And I told him, I said, Dad, you need to slow down a little bit. You're working hard, and it's, you're working 6 in the morning till 6 at night or later every day. And he looked me right in the eye and said, son, I'm only working half days. And I went, that's random, but true. So, and I've used that line a couple of times with my family when they say you work too much. I'm just working half days, it's only 12 hours. So, anyway.
But it's that work ethic, and I love the entrepreneurship that was instilled in you to keep going. And what, how his dad used a freezer. As entrepreneurs, we know that sometimes we just have to figure it out. And that just shows he made your mom clear out the freezer and was like, hey, we need this freezer for this, so we're going to do it. And that's how a lot of times it is. When you own a business or you're building, you're figuring things out. And with Innovation Collective, I do feel it's so great because a lot of us have banded together and use the pathways, but we help each other figure it out or give the resources or the information for the grant. So that's been really helpful. And with you having such a great work ethic instilled and doing the healthcare stuff, I wonder how many people in here know the other side of all the things you do. Can you share a little bit about your businesses and the other things that you're involved in as well?
Well, there's some I'm pretty happy about and some that I'll not talk about.
Disclose the ones you want, that's fine.
I think that's all part of it, Let me start off with, let's just get this one out of the way, the restaurant business, okay? Yeah, the people laughing probably have had restaurants. They know what I'm talking about. But, there has never been a deal that looks so good from the outside until you get on the inside and find out. And, we opened Francis Marie's restaurant in Canteen. I had that open for 6 years, which was, to me, amazing. But that is, it's a tough business in any time. But I think it's really tough. Well, for one thing, COVID. What are you going to say? There's not a business anywhere that wasn't affected by COVID in one way or another, And I was, I guess, fortunate enough to be in businesses like Spring Creek Place Event Center, and I had Soiree for years, and then the restaurants and stuff like that. But these were all things that were predicated on people coming together and doing things. And so at the same time I was having these businesses, I was getting on television as a local health authority and telling people not to go out. So it was a little bit of a paradox there. So, and I had to be very careful. I'll tell you, as a local health authority thing for the health department, which I'm very proud of. And but the thing was, I had to be very careful about what I did at these businesses. At Spring Creek Place Center, we shut that down early in the pandemic, and we kept it closed. And we just, for a year and a half, we didn't have any events out there because, I couldn't in good conscience have an event out there and at the same time I'm going on television telling people not to have more than 10 people, and don't have Christmas with your family and things like this. So it was a tough time for everybody. It was a tough time for people that got COVID, especially in the beginning. I remember going on television and announcing the first person that died in Victoria County. That was a moment, that was something. And it was sad because over the months that we did this, with those press conferences and stuff, it kind of got a little bit mundane. Instead of that big press conference with an announcement that we had a death, it was just the first minute of the conversation when we announced how many people had died the day before. So, I was very involved in that, and of course, in the emergency department, working there through COVID, that was something. I had never in my life been afraid to go to work before. But in the beginning, when we had the original Wuhan strain and then the Delta strain and those things like that, you know, you got that, and it was just a roll of the dice. I mean, if you were going to do well or you were not. And I mean, I saw young, healthy people with no risk factors that were in the hospital for months, and many of them that succumbed to the illness. And then I saw people with every risk factor in the world that had it for 3 or 4 days and got well and never had another symptom. So there was just no way to predict what that illness was going to do to you. And and I remember one time in the emergency room, I was in there, and there were 17 beds in there, and we had 17 patients in there, and 13 of them were COVID positive. So there was no escaping it, and I was seeing, people that I worked with that are getting COVID and everything. And I mean, I finally got it. I mean, there's no way I couldn't. I finally got it last January, but fortunately, I was lucky enough to not get one of the more severe strains. So I think the worst thing I got out of that was, a headache and sore throat and cough and congestion and stuff. But I'm telling you, that's, and a lot of, most of the people out here probably have had it. So it's still something that's around, and it's something that we deal with. And as far as business goes, what are you going to do? We have to live our lives, but yet we have to live them more carefully than we've ever been. Who would have ever thought that we would live in a society where everyone was wearing masks? That was something that happened in China or Japan or someplace else, but it was something that happened here. And, we shut down the city, and we did a lot of things that nobody ever thought would happen. So it was an interesting time, to say the least, and it was hard getting information. I would go on television, and I would literally read the CDC 15 minutes before I went on, because they would change it. You're looking at a local health authority here that in the beginning told you not to wear masks. So, and then 2 months later, I'm saying, don't go outside without your mask, but don't forget about what I said earlier. So it was interesting. Let's just put it that way. It was very interesting.
Well, and I think that has to be a really tough place, right? As a business owner, but also, being so involved in the healthcare in this community, is that you put what was best for the community first, and it's hard because you're watching shutting doors on businesses you own, seeing people pass away, then getting these health reports last minute. So that's a lot of things going on that you're having to juggle and having to deal with. And so I think that that's something to keep in mind when we have people in this community. When you see somebody that is coming on there saying things, he has a family, he has more than just running these, the Citizens ER and these things. He has businesses that he also is shutting down. So when he's giving this advice, that is actually affecting him and his bottom line and his family and things like that. So it's always interesting seeing from all points of views. And when you're talking about all this, I can hear the passion in your voice for the community, and you guys can't see it, but I see his tears in his eyes. And so I just want to say thank you, because that's a hard place to be. I don't know many people who could have handled that role. That's tough. And I think when I'm thinking about your career and your job and all of this and your accomplishments, what do you consider your greatest accomplishment work-wise?
Work-wise?
Yes.
I guess, without a doubt, just being a physician and being able to help people. And, one thing as far as interacting with patients in the emergency department, I always tell the students that I train and the people that I work with, what I tell them is, what you guys have to remember is that you're going to see 15, 20, 30, maybe more patients today. You're going to have 30 interactions with people you don't know. They're going to have one interaction with an ER doctor, okay? And the majority of people, and that's the truth, the majority of people don't go to the ER all the time. There are some that do, don't get me wrong, but God bless them. But the thing is that, you kind of have one chance to make this person understand that, yeah, I'm here, I'm getting paid, and this is my job, but I still care about what happens to you at the end of the day. And that's kind of the art of medicine, I think. And I guess if I had to have an accomplishment, that would be it. Because it was a long road getting there. I was 32 years old when I applied, and I was up against 21, 22-year-olds that were fresh out of college and probably had grade points better than mine. Fortunately, I don't know how I did so well, but I did well in the MCAT and I got in. So, that was tough. But it's an idea of just remembering the big picture, I think. And I think the big picture to me, that all the businesses and stuff like that are nice and they're interesting, they're challenging and things like that. But I think at the end of the day, it's your interactions, and without a doubt, my family. And I have to say one thing, and I should have said this earlier when I was talking about the whole COVID response and everything that we did. I was blessed to work with some of the most phenomenal people in our emergency operations center. I mean, our judge who I can't stop talking about, and Raleigh McCoy, who became one of my closest friends, and died very untimely, of course. And then the emergency people that we worked with, David at the health department, and all the people that we worked with, and all the people that weren't on camera, all the people that were in the background coming up with all the numbers and giving us all the data and coming in at the last minute and saying, this is what we have, this is what we need to get across, and this is how we're going to be transparent today. And we have, I had no idea. I mean, I've been involved with the county and city for years, but I had no idea of the network of people that are down there that have no other horse in the race except to take care of us. And that's what they do, and they really do. So, they're wonderful people, and, you ought to tell them if you ever meet one of them. So, anyway.
But I love the humbleness and how you are referring to your biggest achievement is teaching others and letting others know what you found. That a lot of people think it's a secret, but it's not. It's what you should do, right? Like taking people and putting them first and making them feel important, especially at a time being in an ER can be. It's usually scary because you're in an emergency room. So having them know that, hey, I know you're seeing all these patients, but every interaction matters. How you treat people matters. And every interaction I've had with you, everything I've heard is that you take the time and you actually care and you're compassionate. And that's huge. And that's how all of you in this room, I've had interactions. I'm lucky enough to know each and every one of you. And I really see that happening in this community. And it's a wonderful thing. But the legacy, right, is he's teaching that to others that we're having interactions with. And that is huge. And so you're talking about your career and all the things you've done. I'm curious, how do you define success?
I think, honestly, at the end of the day, what your legacy is and what you've left behind and what people think about you and think about your accomplishments and just really, making money is one thing but at the end of the day, it doesn't guarantee happiness. I know a lot of people that are very, very wealthy and they're just really not that happy, But then again, people that aren't wealthy and they're the happiest people around. So I don't think it has to be tied to success and wealth. I think it has more to be, at the end of the day, at the end of the day, all of us are going to lay on our deathbeds one of these days. And, I'd like to be able to look back and think that, that I made a difference. And I think that that's what everybody in this room would like, is to know that they made a difference in somebody else's life. I take it that's your son, and that's your difference, and that's the thing that you do. The proudest thing I've ever done is my 3 little girls. So, and I didn't get married till I was 50. So I have 3 daughters that are 8, 8, and 5. And everywhere I go, it's like, oh, Grandpa, you got the kids? I'm like, yeah. So anyway, my dad told me, he said, son, don't ever get married before you're 50. And I think he told me that so many times that it kind of got in there. And so anyway.
Well, and I think you're right. That's it. It's legacy, right? It's true legacy is how you treat others and what you leave behind and how you touch people's lives. And that is what it's about. It's about the impact that you're making on others. And you're right, as far as wealth, it's great building wealth and all a net worth, but at the end of the day, if you're not a good person treating other people with kindness, what does it stand for, right? Nothing. So you're absolutely spot on. And I know I have a lot of people in this room that are wondering, because you have found success, how to find success as far as find their way or their journey of where they're going. How would you give them advice on finding their success or finding their way?
I guess just don't be afraid to try different things, who would think a doctor would own restaurants or, probably, I like to farm, I raise corn, I raise cattle. There are a lot of things that give me enjoyment. They may not be the most profitable thing in the world. Growing corn in a drought is usually not a good thing. So, and it's been pretty dry, let me tell you. But, I think it's just the whole sum total of everything. and just looking at it one day at a time and doing what you can do. And you know what? If things don't work out, I mean, I had that restaurant open for 5.5, almost 6 years. And, but, there's the old thing in medicine, when the pain exceeds the pleasure, the behavior will change. So, and that's exactly what that was. And I told my wife one day, I said, when 5% of our income is 75% of my grief and things that I have to deal with, then something's got to change, And I was fortunate because there's a gentleman that wanted to take over the restaurant, and he has the time to dedicate to it, to be there. And that's, I didn't have time to do that. I was working across the street at Citizens. So I think that's a good deal. So, the name has gone on, and I eat there. The food's still pretty good. I mean, the food's great. So,
can you tell them what the restaurant, who it's named after, so they know?
Yeah, that was the thing. My mom had breast cancer, so I lost my grandmother and my mother to breast cancer. So, I'm a pretty big early prevention and screening kind of guy for breast cancer. You can ask my patients. I scream at them about mammograms all the time. But the thing is that when I bought the old Siesta restaurant, that was the old Siesta, and the people that have been here forever know Siesta restaurant forever. They were there 30 years, and so we bought that property, and then my mom got sick, so I named it Frances Marie's after her, and she was within 6 months. She died 6 months before we opened, so. She never got to see it open, but I took her over there a lot during the construction phase and showed her that's where this is going, and she got to see a lot of it. So, and I know she still saw it. So, but that's where the name came from. It was named after my mother. So, which when you add the emotional part to it, that makes it even rougher because you're going to put everything you can into it to make it be successful. And I think we did well there. I mean, I liked it, and it was a good experience. It really was. So now I have Tropical Smoothie too. I have that little one over there. And
that place is great.
Yeah, that place is good.
They have a drive-through. I love it.
Yeah, but the thing about that is that it's and this is something that I had kind of steered away from, was the whole franchise model, of somebody else telling you how to run your business. But after I had Frances Marie's, I welcomed somebody else telling me. And, I mean, really and truly, they're up to over 1,000 stores now nationwide. So it's a major chain now. And I mean, when they send down a new recipe for a new smoothie, it ain't something that John made up the day before, okay? It's something that's been tried, and they've done all this, and they've got real chefs doing, they're analyzing the different things that are going into it and exactly how much. And they send us a recipe that, I mean, 1 scoop of this. Hell, they'll send you the scoop. I mean, not just 1 scoop. They say this scoop. So, and that's what they do. And you pay a little bit for that, but it's not a bad way to go. I'm telling you. So don't be afraid of franchises. I mean, I think you pay like 8%. But I mean, for all the national advertising that they do and all the stuff that they provide, and I don't have to make up. I don't have to do the artwork on the design. I didn't design the sign. I didn't have to, make the hours of what it's going to open. Things like this. I mean, they do those things for you. They do the training. They send you down information. So there is quite a benefit to the franchise model. So because I've kind of seen it from both sides, and it's a whole lot easier. It's a whole lot easier.
Well, and I do think that's so interesting, right, is that you have literally been in the trenches on both sides. You've started a restaurant from the ground up, and then you've done a franchise. So for those of you, I know there's some people out there thinking about starting their own, or maybe they've asked me questions about franchising and what that looks like. And a lot of people do think sometimes that's scary, but here's somebody who's done both, and he really does enjoy the franchising. So I think it's really neat to have a side-by-side comparison of somebody who's done both, because that is pretty rare, of someone who's been in the restaurant industry from both sides of it.
Yeah, well, I mean, don't get me wrong, they're both still challenging. They are, but
that's business sometimes, right?
Yeah, that's business. If it was easy, everybody would do it. So, but yeah, that's pretty much that. I mean, I like it, and I like that Bahama Mama. That's the one I drink. It's probably the most unhealthiest one on there, but
it's really good. It's really
good. Yeah. So I've tried the healthy ones, and I'm not a kale guy. Sorry. So I'm just not.
I appreciate your truthfulness, because that's my favorite there too.
There you go.
So what would be the advice you got that you just thought was the best advice that you've ever gotten from somebody?
Well, my parents were always very supportive, and And I think that's probably one of the reasons that I became a physician, because, it would have been easy for me just to continue being a paramedic. And, there were several times during that 10 or 12 years that I was working there full time that I considered just, go ahead and trying to get into medical school at that point. But I loved what I was doing at the time, but I just didn't think it would be a sustainable thing. So I think that probably the best advice you could ever get would be, to play the long game, I mean, don't think about it just as tomorrow. Think of it down the road, and think about what you want in your life. And I always wanted children, I really did. I just, the way I lived, I worked, 100 hours a week. And even when I met my nurse, but hell, I met her at the hospital because it's the only place I ever went. So, it wasn't like, I didn't go to clubs because, I didn't get off in time to go to the clubs. They closed at midnight. I was still working. And so, she was a nurse upstairs, and, that was that. I just, it was, there wouldn't, unless I met her at HEB when I was, or actually I did most of my shopping at Walgreens. So,
They're open late.
yeah, they were open later. One night I wanted an egg sandwich, and I'm hungry for an egg sandwich. So I went to Walgreens, and I bought a skillet, a spatula, a dozen eggs, and some bread. And the lady looked at me and goes, "You can go home and make a sandwich?" I said, "Yes, ma'am, I am." And that was it. I would, it was hard for me to wash, so I bought lots of socks and underwear. So it was easier to go buy a 12-pack of socks than it was to wash. So I got lots of socks.
I think we're getting the secret insider scoop on doctors' lives in the ER.
Yeah,
yes, true tales.
It was.
So who is one of the most innovative people that you've met, and why?
I think that I've been around so many people that I was really, especially in medical training, you train at these big facilities, they're big tertiary centers. I trained at John Peter Smith Hospital in Fort Worth, and that's an 800 or 900 bed hospital, or it was 20 years ago. And our emergency department had its own police department attached to it. It was Tarrant County Hospital District. In that emergency room, you walk through metal detectors just to get into the place. And so, you're at a big facility, and you train around these people, and it's interesting because they'll tell you. I did some time up in Houston at St. Luke's, and when I was doing some training for liver diseases, and I remember the first day I got there, the lady that told me, she said, "I want you to go read this chapter on liver disease." It was the Washington Manual. It's a book, and but it's kind of like one of the Bibles of medicine, So I went in there and I started looking at the deal. I sit down and start reading it, and I look, and it says, and it was the lady that told me to go read the thing that wrote the chapter. So, that's kind of, you're around those kind of people, and the people that I remember Dr. Bauer from the University of Texas, and God rest his soul, he died, but we taught advanced trauma life support all over Texas, and I was on his team, and I would travel to areas, and we'd bring this trauma training to different smaller areas that couldn't have their own trauma programs. And there were procedures that we were doing that he wrote the original papers on. So it was just, it was nice to be around people like that. So I guess probably just by default, the people that I was around the most, that probably impressed me the most, were physicians that took their time to actually publish these papers and make changes that change, thousands of lives. Because, these papers go out all over the world. And, he invented a procedure called the diagnostic peritoneal lavage. And before CAT scans, we would poke a hole in the stomach and run fluid in, and then we'd take the IV bag and lay it down on the ground. And when the fluid ran back out, if it was red, well, they were bleeding on the inside. It's kind of primitive, but that little procedure has saved countless lives all over the world. And he was the one that started that deal. He was one of the ones that wrote the original paper on it. And just things like that, when you get to train with people like that, and you get to be around people like that, it makes you want to be able to train people and teach people, albeit on a much smaller basis, of course, but it's still nice to be around people like that. So I guess just by default, those were probably the people that have impressed me the most, or probably molded me into whatever it is I've become. So.
And then, are there any books that you've read throughout your life that just really impacted you, that you think would be really good for people in the audience?
When it comes to reading books like this, my wife is an avid reader, and she reads books all the time on all kinds of different topics. And really, as far as reading for enjoyment, every time I would pick up a book and start reading something, I would feel guilty that I wasn't reading something instructional in medicine. So probably 90% or 97% of everything that I've read had some kind of medical something to it. So, and these are journals that and books that I wouldn't recommend for the general public. I mean, unless you really like reading things like that. But I mean, no, so most of the reading that I do, and if I read something for enjoyment, I feel kind of guilty that I should be reading a new study of a new way to do things or something like that. Because, in medicine, I mean, I shouldn't tell you all this, but I will. It's amazing what you can learn from things like YouTube. I mean, there are procedures that doctors do that are very well done on YouTube. And there are medical YouTubes that are available. And I use a thing every day called Up to Date. And it's just peer reviewed, and it's reviewed every few months by leaders of every discipline in medicine there is. And it's all where I can click on it and bring up the latest stuff. So, there's a lot of times when I'm back there charting on a patient, I'm looking up things on Up to Date to see. I think there were some medical students that were going to be in here somewhere, but Up to Date
right
is
up front, right
yeah,
there.
There they are.
Hi, medical students.
Yeah, they told me there were some medical students in here, and I told when they told me that, I said, well, good, now I'll have the opportunity to talk them into becoming lawyers. So, not really. It's a great profession. So.
Well, and I think his example of reading is so important because, I have had a lot of you come to me with that, oh, well, I feel guilty because I'm doing this or that. But if you're into something and you're passionate about it, it's okay to read about that thing, if that's what you choose to read about or get into, and to grow knowledge in your field or what you're doing. And so that's okay. And you have someone here that does that, and it's okay to be into what you're into and stay in that lane if that's what suits you. And I think reading, right, it's a choice of what you want to choose. Your wife's reading all kinds of things, and she can fill you in on that, and then you go read your medical things. And so it's all up to us what we want to read, what we want to fill our time with, and what benefits us in our life. So that is a choice, and we all have that choice to make with what we choose to read or, ingest. And as I'm talking to you about growing up in Victoria and being from here and all of those things, I'm curious for the future of Victoria, everything that's going on right now, kind of what is your hope for the future of Victoria? What would you like to see, and how would you like to see it grow?
Well, I grew up here, and I can remember when I turned 16 years old, we lived here on the Coral Highway in town, and I had my girlfriend lived in North Crest, which is, the north side of town now. But my mom didn't want me going out with her because she lived too far out in the country. So, but if you remember, back at that time, Navarro wasn't Navarro. Navarro was known as the Hallettsville Highway. And right there, where Speck's Liquor is, that would be the one I know, I guess. But if you drive right past there, it turned into just 2 lanes, and it went to Hallettsville because it was the Hallettsville Highway. And so, so Victoria has definitely grown, and I think it's grown in the right direction. I'm excited because, I think we've grown north a lot. I think hopefully, now we're starting to see some stuff, especially with the new West High School and stuff. I think there's going to be more stuff going out 87. And then I'm seeing a lot of rejuvenation on 59, and that's real exciting. Starbucks is coming over there, and or they're trying, but not Starbucks. Chick-fil-A. Chick-fil-A is coming over there, and I think that's an interesting thing. That Chick-fil-A is going to be down there, and I think there's several other things that are going to come on that side of town, and so I just see Victoria kind of just growing in all directions, and I think that's good. Because Victoria can grow and still not be too big. Unlike Sugar Land. I remember when I lived in Central Texas, when I lived in San Marcos there, San Marcos was a city, and then Kyle was a city, then Buda was a city, and then you went to Austin. But if you've driven up and down 35 now, from San Antonio to wherever, Round Rock, is just continuous everything. So anyway, I don't think Victoria will do that, and I'm kind of glad it won't do that to a certain point. But I think our town's growing. I think it's growing appropriately, and I think y'all have done a good job.
Thank you.
So I think it's something. I think it's a great place to be. I really do. I mean, I had job offers. Coming out of medical school, they always inundate you with offers. They want you to stay up there, become a teacher, and there's jobs everywhere when you first get out of residency. But I chose to come back to Victoria, and I wanted to be in Victoria, and I wanted to have a practice here, and I wanted to be part of the community, and that's how it happened.
And do you find working in the medical field, since, Innovation Collective, we talk about innovation, do you discover innovations all the time? Because I know things are rapidly changing and moving. At Citizens, where you are in the ER, are you guys innovating? What goes on there?
I tell you, I mean, one of the things, especially with the internet, I mean, there's so much information out there now. I mean, back in the day, you'd have different areas that had kind of different standards of care and different ways of doing things, and it was predominantly the main physicians in that area kind of set the tone for that. But it's not that way anymore. I mean, now everything is pretty much standardized. For trauma, we have advanced trauma life support, and the American College of Surgeons sets those standards. The American Heart Association has advanced cardiac life support and pediatric advanced life support. So we have all these standards of care. So really and truly, you should get the same care here at Citizens that you would get if you were at Mayo Clinic. I mean, if you were anywhere else, because the standards are set, and CMS, and we're always being evaluated. Our stroke care at Citizens is phenomenal, and it's as good as anywhere in the nation. So, that's just because of these standards that we set. And fortunately, I'm lucky enough to work at a hospital that really makes you follow those standards. And so, it's a learning deal. Things that I was doing 20 years ago, I don't do anymore. Because we have better things. Before, very few people got CAT scans in the emergency department. Very few people years ago. You just examined the patient, you did the best you could. Nowadays, if you say the word abdominal and pain in the same sentence, you're getting a CAT scan. So if you bump your head and you think your neck might hurt, you're getting a CAT scan. So, and the scanners are better and quicker. They can scan your brain in 50 seconds. So we can do your head, neck, chest, abdomen, and pelvis in a minute or two. So I'm saying that the technology's out there, and we're getting a new MRI. We're getting a new higher Tesla, what they call it, an MRI, that's going to be able to see things that that we were never able to see before. So it's an exciting time to be in medicine, but and every day it gets more exciting. There's more things that they're doing. These students here, they're gonna learn things that I'm gonna have to go back and relearn, because they certainly didn't have that when I got out of residency. So, and that's been 20 years ago. 20 years is a lifetime in medicine. It really is, with the advances that they're making. So.
And I think that's such a good point, right? Is he has a job that's constantly evolving and changing and growing. And I know a lot of you, with what you're doing in business, you can be doing something one way, and you got to realize, even if it's not in the medical field, it's okay to change and evolve and bob and weave and do something different. As he said, COVID threw a curveball for all of us, and I've really seen a lot of people adapt and change and do things that were innovative and different. So, it's been really interesting to watch that, but also to think about a job that you have that constantly information is coming out, and you're having to learn new things and read new things and implement those as well. So that's really amazing when you actually take a step back and think about that. And, I just have to say, thank you so much for choosing to be in Victoria and to do what you do, because you've affected so many lives. You talk about leaving a legacy. You've left a legacy. Every time I talked about you, they're like, oh, that guy's great. Oh, man, my mom or my grandma or me, or, so just know that we appreciate you, and we're thankful to have you here. And